Hey guys, Tony Maritato here again, licensed physical therapist. So in the last video, we talked about squatting progressions from a sit to stand to holding onto the kitchen sink to an unsupported squat. Today, I want to talk about a lunge progression. So after your first total knee replacement, what we want to do in the clinic usually is we want to work on some version of a partial or modified lunge. I like to do it next to the kitchen counter because this gives me some stability, it gives me some support, whether my surgical leg is in the front position or my surgical leg is in the back position. I want to build confidence in what the knee will tolerate after surgery. The first 2 to 4 weeks, I'm basically just working in a stepping motion. This is also going to help improve gait quality, mechanics. But then once I hit kind of the end of the month to the first 6 weeks, I want to start increasing the depth. And so a lot of times what I'll do is I'll progress to a position where the surgical leg is forward, the kitchen counter or cabinet is in front of me, I've got the sink to hold on to. And what I do is as I go down into a squat position, I'm thinking about touching my surgical knee to the front cabinet. This is usually the most comfortable, the safest position. I'm not applying pressure, I'm just using this as a landmark to say, okay, I can get there. As I get stronger, I'll come lower with the non-surgical knee. I might put a pillow or a cushion underneath there, roll up a towel, just so I'm not kneeling on a tile or hard wooden floor. But the idea is this is what I would be trying to do at around the 6 to 10 week mark. Once I've achieved this with the surgical leg in front, depending on your surgeon's recommendations and what you're allowed to do, I might progress to the surgical leg behind. Now, this range of motion is more than 90 degrees, so you have to know first, do you have the range of motion to go into a knee down position? Do you have the tolerance? Is there sensitivity that's going to limit the pressure you put on the knee? Again, I can put cushions under there. I can put couch cushions or anything like that to soften the pressure on the knee. But this would be something you might consider advancing to under the guidance of your physical therapist. And then the whole goal of all of this is when I have to get something out of a low cabinet at home, I want to be able to do that, right? So if I have to open the cabinet, reach down in there, I want to be able to get down in this lunge, crouch position. This would be something that at 3 months post-op to 6 months post-op, I might be working on so that I've got the independence and the functional mobility to do some of this stuff at home. So guys, if you have more questions, post them in the comments. I'll see you on the next video.